In this video, we will learn how our body keeps sugar levels normal. And how does dietary fat become part of our bodies? The process of controlling blood sugar is very complex, and the body has to maintain it in a very limited range. Sugar should typically be 80 to 90 milligrams per 100 milliliters of blood on an empty stomach, which is defined as the time between dinner and breakfast, which is approximately 8 to 12 hours long. And this amount should be 120 to 140 milligrams immediately after breakfast or within an hour. The human body has a system that naturally controls blood sugar levels within 2 hours of eating. This is known as a negative feedback mechanism. What is a negative feedback mechanism? The human body controls sugar through a negative feedback mechanism so that the amount of sugar in the body can be kept normal. When you eat something, it goes through your gastrointestinal tract. As seen in the diagram, food goes from the mouth to the esophagus, then into the stomach, and finally from the small intestine to the large intestine. And then eventually accumulates in the rectum. After the food is absorbed, the amount of sugar starts to increase. The beta cells of the pancreas then release insulin into the bloodstream. Due to insulin, all cells in the body begin to absorb sugar. And when this sugar reaches the liver, it is stored as glycogen. As a result, the amount of sugar in the blood is reduced to the desired level, a process known as homeostasis. On the contrary, when the body's sugar level drops, the alpha cells in the pancreas release glucagon, and when the glucagon reaches the liver breaks it down and releases it in the form of sugar, causing to increases the sugar. To understand sugar, first learn how it functions in the body. After eating, the amount of sugar in the blood increases, as does the amount of insulin in the blood. When you eat something, it goes through the alimentary canal and is turned to sugar. Now, it is critical to understand why sugar is so vital. Because sugar is the only food that the brain, eyes, and reproductive organs require. When food passes through the intestine, sugar levels rise, prompting the pancreas to secrete more insulin. 2/3 of the sugar in food is absorbed through the alimentary canal and transported directly to the liver, where it is stored as glycogen. Conversely, as the amount of sugar in the body drops, the amount of glycogen and adrenaline increases. The liver produces sugar. They are generated in two ways, through gluconeogenesis and glycogen breakdown. Glycogen converts to sugar, which is then transported to fatty tissues. This is known as adipose tissue. They also include glycerols in adipose tissues. When these glycerols reach the liver, they contribute to gluconeogenesis. Following a meal, insulin synthesis in the blood increases. As soon as you eat, it goes through the gut, and the amount of insulin produced increases due to the high sugar content of the food. Insulin is a muscle-building hormone that aids in the digestion of food. Examples include carbs, lipids, and proteins. This table provides a detailed explanation of the importance of insulin. It contains all of the important facts regarding the insulin decline and increase. Insulin produces beta cells in the pancreas, which release insulin into the bloodstream via the portal circulation. The entire process occurs instantly once the sugar level rises. We try to understand the entire process using the pancreatic diagram, which is made up of little islets. A typical pancreas contains around 1 million islets that are distributed throughout the exocrine parenchyma. This diagram depicts an islet and its blue cells. These are known as beta cells, and they are responsible for producing insulin as well as the cells that surround them. These are the endocrine cells that produce glucagon, somatostatin, and pancreatic polypeptide hormones. Proinsulin is a membrane found in pancreatic beta cells that releases insulin along with an equivalent number of C-peptides. When blood sugar levels are high, insulin is rapidly released. As shown in the image, the initial insulin is normal. This condition is known as basal secretion. The insulin levels rise within 5 minutes. This is known as the first phase, in which insulin levels quickly drop. The second phase of insulin action is when it continues to increase and decrease as needed. Furthermore, several variables stimulate insulin release, including amino acids and hormones such as the glucagon-like peptide, which is a hormone that inhibits glucagon secretion while raising insulin release. This leads to a drop in sugar, and this hormone is released into the food pipe. When the pancreas secretes insulin, its purpose is to increase the amount of sugar in the blood, but sometimes the amount of insulin surpasses the amount of sugar. Sugar enters the body from the mouth. As a result, when food travels through the food pipe, it releases a hormone. It also allows for the release of insulin in response to the hormone glucose. The hormone glucagon-like peptide guarantees that, in response to sugar, as much insulin is released as is required. This lowers the danger of low blood sugar. However, glucose-like peptides diminish a wide range of variables. As glucagon secretion reduces, food digestion slows, appetite declines, and weight loss follows. When food goes through the food pipe, it produces a glucagon-like peptide. The primary reason is enzymes. Dipeptide peptidase 4 is a related enzyme. Substances that inhibit this enzyme are utilized to prolong its advantages. A dipeptide peptidase 4 inhibitor is a medication taken by mouth, also referred to as gliptins. Examples include sitagliptin, vildagliptin, and saxagliptin. They also lose weight and have certain adverse effects. People with diabetes who have been on drugs for a long period exonated and liraglutide convert them into synthetic glucagon-like peptides. On the contrary, many patients have lost weight as a result of these treatments. People who use it receive subcutaneous injections on a daily basis, and nausea is typical as a result of its continued use. People who take exonated to treat diabetes frequently develop pancreatic inflammation. There are numerous studies in which synthetic glucagon-like peptides are administered to patients once a week. Furthermore, several studies have indicated that such medicines are extremely beneficial to overweight patients. Insulin limits the amount of sugar produced in the liver. Attempt to comprehend this process using the diagram. First, the pancreas releases insulin because the liver is constantly generating sugar, but when the insulin reaches the liver, it pauses the sugar-making process, allowing the insulin to enter the bloodstream. Unnecessary sugar accumulates into skeleton muscles. Adipocytes store sugar and produce triglycerides. Let us observe how they are manufactured. The body's adipose tissues produce triglycerides, which are composed of free fatty acids and glycerols. As a result, insulin in the body speeds up the process of lipogenesis. The function of lipogenesis is to transform free fatty acids and glycerols found in tissues into fat. In addition, insulin slows lipolysis. This converts triglycerides into free fatty acids and glycerols. The delay of this process causes a rise in triglycerides in the body. Result: catecholamines and free fatty acids are required to expedite this process, which also reduces triglycerides. The free fatty acids found in adipose tissues serve a vital function in the liver. When free fatty acids enter the liver, they begin to oxidize, causing glycerol to be released from the adipose tissues and to travel to the liver, where it promotes gluconeogenesis, which leads the liver to produce sugar. As a result, the liver initiates the ketogenesis process, which results in the formation of ketone bodies in the blood and urine. Ketone bodies are organic acids that, when produced in small quantities, are oxidized and used as a metabolic fuel.